Good morning. Hope you're all very, very well. So this week's video is on anything that has inflammation or redness and it's appearing in the skin or body. So it will sort of cover some very helpful tips for anyone who's getting histamine responses, especially their eyes are blowing up and it's going up and down from eczema or psoriasis, any red, weeping, skin irritation. So first question is, why do we get these? So it's part of our immune system's response of saying, hey, the immune system is working, but it's overfiring, and you need to find out what you're doing or what environment you're putting your body into, and then to use nature to assist the immune system to downregulate the symptom or to heal itself, because the body is the healer. We just want to listen to these symptoms that it's telling us. So histamine responses is very, very common today, and I think one of the reason is because our nervous system is overstimulated. So first thing you want to identify is it more, if it's the eyes, like when you see the weepiness, particularly in the eyes, the eye is the thinnest skin on the body. And when you think about that, there's no oil glands within that eye socket. So once you've got, the body's got an internal flare, it's going to usually show up in the thinnest part of the body. And you will see often the eyelids blow up first. And then you can get progressive swelling to the point where you can barely open the eyelid. It can get really bad. So you want to deal with that as quick as possible. So when you see that blowing up, you know that there's no oil glands to get out. Like my cheek has about 500 sebaceous glands or oil gland, and my décolletage has very few in comparison for the surface area. So there's nowhere for the heat to get out of the eye. So the inflammation is holding and it's getting bigger. So topically, you don't want to do a lot, less is more, but internally you want to figure out what that root cause. Now, initially, while you're trying to figure out the root cause, we want to help to bring the histamine response down so you can have quick relief. So that's where I turn to herbal medicine. I turn to these two. So these two, if you combine them, will really, really help quite quickly. So one's called quercetin protect. So quercetin is a natural antihistamine, and when taken in such a strong dose, you will get relief quite speedily. And I like to bring in a super mushroom complex with astragalus because the nervous system's having a tough time, and we want to really bring down that inflammation marker. So this will support the immune system with the mushrooms, and then it will support the adrenal glands that are firing the extra adrenaline and cortisol, so it will help bring that cascade down. So we take these as prescribed for the time needed to bring that inflammation down. So initially we go there. I might, if it's got heat, I might bring in some water-soluble antioxidants. So I might put some antioxidant gel just topically on the skin to form some relief. And then maybe a warm compress, and combining that with a cool, so starting with warm and then doing a cool, to just use a little hydrotherapy to help calm it down a little bit. But generally less is more with the eye. Now, what could be some root causes of a histamine response? So we'll look at food. So my 5 allergen foods, I recommend removing them for 2 months. What are the 5 allergens? We've got cow's dairy, genetically modified wheat, which is pretty much all wheat in Australia. You want to be, if you're going to have it, you want to be having a sourdough spelts or kumut, which is the original wheat. But for this purpose, I'd pull it all out. We want processed sugar, peanuts, because they have mold, and we want oats out too, because they tend to have histamine response. We want to pull those 5 allergens out for 2 months strict, and replace them with a plant-based diet, more easy to digest cooked foods, and allowing that body to have that benefit of it, to the digestion to have that relapse loop to start healing itself. We want to be looking at sleep. We want to be sleeping between the hours of power. So 10 p.m. to 2 a.m. we're wanting to be getting that deep night sleep. We're wanting to look at hydration, so making sure we've got filtered water and we're having 10 to 12 cups a day between meals, so we're not watering down our stomach acid, and adding in a bit of electrolyte. So your Celtic salt's really beneficial there, and before meals you could do some hot water with some lemon. Now, once the skin's calmed down in the histamine response, we then want to get back into rebuilding the vitamin A into the tissue where it's come from. So that's sort of your histamine foods. Now, other causes could be heavy metals. Think about if you've ever had any metal in your mouth, like I have, exposed in medications with heavy metals, environments, mold. So mold is a big problem, and that's why some people's histamine responses flare more up in seasons where nature is dying off, because there's more mold in the atmosphere. That person probably indicates they've already got some mold inside the body that it needs some assistance. So again, we need to look at using different herbs to clean the mold out of the tissue, and then to assist nature again to eliminate and to rebuild. Also looking at general lifestyle speaking, so mental side of it, because mental stress has a big flare when it comes to skin irritation, redness and rashes and histamine. So looking at managing the mind and trust and handing it all over, not holding on to all of this stuff yourself, past traumas, things like that. So actually dealing with that, sometimes that will be a factor. And with holistic, always think big picture. It's never usually one thing, it's usually a combination of things that are combined together. So if you have got all that flared down, or let's say it's on the body, so you've got the inflammation out, it's no longer red. Now we want to kind of help the skin to heal. So when it comes to the body areas, we want to, once the fluid is cleaned and it's no longer red, but it's scaly and a little bit angry, that's when I'll bring in some topicals. So I'll bring in these two body products. So I'll use some vitamin A, C in oil, and a little bit of urea acid and lactic acid. And what that's going to do is just gently slough off the dead tissue on the skin, and then get those vitamins in there to give the skin factory the ability to heal and redeem itself. So just consider the lifestyle piece. So food is going to be a big part of histamine. Rest is going to be a big part of histamine, because when you're sleeping, that's when you're healing. And then hydration is going to be a big part, but we have to also sometimes use some concentrated herbs, and that's always where I'll use some quercetin, some immune boosting ingredients. And then topically, we want to get those vitamins A, C and E back into the tissue in a form that the skin can handle. So if there's heat, we don't want to be putting oil-based products on the skin. We want to be using a gel-based or a water-based. But if the heat's out and the skin's ready to have a little bit of a stronger work, that's when we can bring in the oil-based. It is a tricky condition, but it is really recoverable, I promise. I see it all the time. We have to keep tinkering with the lifestyle until we get the right nutrition for that body to go back and heal. Any skin response like this, it's your body doing you a favor. It's screaming for help. And all we want to do is go, listen, okay, get the information, and then start doing the work in assisting the body to heal. Okay, hopefully this video was helpful. Any questions, please leave them in the comments below, and I wish you all a really beautiful day. Bye for now.